Hemorrhoids are a very common anorectal condition, and it affects millions of people around the world. Over half of all people will develop symptomatic hemorrhoids at some point, so it's common to wonder how to get rid of them. Most patients are able to get rid of them with a high-fibre diet, herbal supplements and non-surgical medical treatments, such as using a DIY hemorrhoid cream with turmeric and tea tree oil. Hemorrhoids are frequently seen in primary care clinics, emergency wards, gastroenterology units and surgical clinics. But how do you know when a hemorrhoid has developed and when you should see a doctor? There's some common concerns among people who develop hemorrhoids and don't know how to deal with them or to treat the pain. Thankfully, there's some natural treatments for how to get rid of them fast. You might be wondering why it's so important to know how to get rid of the hemorrhoids, especially if you've never experienced them before. It's because no one is immune to them. We all have hemorrhoids. Hemorrhoids are normal cushions of tissues that are filled with blood vessels and are found at the end of the rectum, just inside the anus, together with a circular muscle called the anal sphincter. The hemorrhoids help to control the bowel movements. When people say that they have hemorrhoids, what they really mean is the hemorrhoids have become enlarged. Enlarged hemorrhoids are often associated with symptoms like itching, mucus discharge or bleeding. The bleeding happens when a hard stool damages the thin walls of the blood vessels in the hemorrhoids. There's two basic types of hemorrhoids, the internal and the external. The internal are more common. The external tend to feel like a large lump around the outside of the anus, and they can make sitting painful. Bleeding is fairly common with a swollen external hemorrhoid. Swollen internal hemorrhoids can come out of the anus, and these can be seen as soft lumps of tissue. These are called protruding or prolapsed hemorrhoids. The large hemorrhoids can make it feel like something is pushing against the anus, and this can make sitting very uncomfortable. Hemorrhoids are classified by grade, which is based on how severe they are. Grade 1 is slightly enlarged. These hemorrhoids can't be seen from outside the anus. Grade 2 are larger. They may come out of the anus at times, like when passing a stool, but then go back on their own. Grade 3 hemorrhoids come out of the anus when passing a stool or engaging in physical activity, and they don't go back in on their own. They can only be pushed back inside the anus. And grade 4 hemorrhoids are always on the outside of the anus. They can no longer be pushed back inside. A small bit of the anal lining may also come down from the lower rectum and out of the anus, and this is known as a rectal prolapse. The most common symptoms of hemorrhoids are anal bleeding, and the chief complaints include a peripheral mass protruding from the anus and anal discharge. Other symptoms include irritation and itching around the anus, fecal leakage, sensitive lumps in the anus, painful bowel movements, protrusion of skin during bowel movements, and blood on toilet paper after having a bowel movement. A particularly painful form of grade 4 hemorrhoid comes in the form of a thrombosized hemorrhoid. This refers to usually an external hemorrhoid that has no blood flow because the vein connected to them has a thrombus or a blood clot. The thrombus responsible for a thrombosized hemorrhoid will often reabsorb within 2 to 3 weeks without major treatment. The pain originating from the swelling and inflammation of the hemorrhoid is usually the worst in the first 24 to 48 hours after it develops. People with hemorrhoids are at an increased risk of portal hypertension. According to WebMD, portal hypertension is an increase in the blood pressure within the system of the veins called the portal venous system. The veins coming from the stomach, intestine, spleen and pancreas merge into the portal vein, which then branches into smaller vessels and travels through the liver. Many people find themselves wondering, do the hemorrhoids go away? Most swollen hemorrhoids do go away, given that you follow a wise regime of diet and bathroom habits, as well as other additional treatment methods recommended by your physician. Hemorrhoid symptoms usually clear up within a few days for most people, but they can reoccur or require medical attention in some cases. If the symptoms continue for more than a week or two, or haven't been improved by a home treatment, it's probably time to visit a doctor. For those who already have frequent hemorrhoids, dietary intervention can be one of the best ways to get rid of external and internal hemorrhoids once and for all. Although people assume that any pain when using the toilet is hemorrhoids, there's a number of other anorectal disorders that can also cause symptoms, including dermatological diseases, diverticulitis, an abscess or a fistula, a fissure, a sexually transmitted disease, warts, HIV, infections and inflammatory ulcers. These conditions can be ruled out by a doctor when you go for a rectal exam if they aren't the cause. People are sometimes confused by the difference between diverticulitis and internal hemorrhoids. The diverticulitis is a condition where the sacs or the pouches within the colon become inflamed and press into the colon. While some of the symptoms and the root problems are similar to what causes hemorrhoids, the diverticulitis tends to be a bit more serious, and it's related closely to age and poor dietary fibre intake. Researchers propose degradation or disintegration of the supporting tissues of the anal cushions cause the hemorrhoids to develop. There's some contributing factors for the hemorrhoids, including being overweight, regularly lifting heavy objects, aging, pregnancy and giving birth, hereditary, constipation or chronic diarrhea, faulty bowel function due to overuse of laxative or enemas, spending excessive periods of time on the toilet, an increase in intra-abdominal pressure during pregnancy or when constipated, and sitting on the toilet for a prolonged period of time while straining are major contributing factors for the development of hemorrhoids. A weakening of the supporting tissue as a result of aging and genetics might also serve as another cause. Many dietary factors, including a low-fibre diet, spicy foods and alcohol intake, have been implicated, and possible causes of hemorrhoid symptoms also, but the research proving this is inconsistent. It's also been published that Caucasians of higher socio-economic class were afflicted with a greater frequency of hemorrhoids, but this data might be limited because it's based on people's healthcare seeking practices. When you go to see a doctor for enlarged hemorrhoids, he or she will look at your anus to see if it's inflamed and whether the hemorrhoids come out of the anus when you push, or if they're already on the outside. Depending on the severity of the symptoms, there's a number of examinations that the doctor can choose to perform in order to make a diagnosis. Doctors typically do a digital rectal exam first, and this involves gently inserting a finger into the anus with gloves and lubricant. The doctor will feel the inside of the anal canal using circular movements, and this allows him to examine the sphincter muscles and the texture of the membranes lining the anus. If your doctor believes that you have enlarged hemorrhoids, he or she will likely perform a proctoscopy next. This involves inserting a short tube with a light and a lens on it, a proctoscope, and this examines the membrane lining of the rectum. The doctor is looking to see if there's enlarged hemorrhoids and how big they are. People tend to fear the pain and discomfort that comes with these procedures, but they usually don't hurt. Most of the patients suffering from hemorrhoids have their symptoms alleviated through diet, therapy, fibre supplements, hemorrhoid cream and medical treatments, such as sclerotherapy, rubber band ligation and infrared coagulation. Sclerotherapy is a procedure that involves injecting a chemical, the sclerosant, into the vein to destroy it. The sclerosant is used to damage the innermost lining of the vessel, and this results in a clot that blocks the blood circulation into that vein. Over time, the vessel turns into scar tissue and fades away. In 2010, a group of 338 Japanese medical institutions reported good results for sclerotherapy using aluminum potassium sulfate and tannic acid. Upon injecting this into grade 2, 3 and 4 hemorrhoids, out of 3,519 patients, 98% reported positive effects within 28 days. Rubber band ligation. This procedure is used to remove hemorrhoids with a rubber band. Your doctor inserts a small tool called a ligator through a tube into the anal canal. Then the doctor grasps the hemorrhoid with a forceps, slides the ligator cylinder upward, and releases the rubber band around the base of the hemorrhoid. This rubber band cuts off the hemorrhoid's blood supply and causes it to wither away. A 2000 study published in Digestive Surgery found that rubber band ligation is a useful, safe and successful method for treating symptomatic second and third grade hemorrhoids and can be applied successfully in fourth grade cases, but with an increased rate of recurrence and additional treatments being required. Infrared coagulation is a procedure that is used for internal hemorrhoids. The doctor uses a device that creates an intense beam of infrared light, and this causes scar tissue and cuts off blood supply to the hemorrhoid. When the hemorrhoid dies, a scar forms on the anal canal below the lower rectum, and the scar tissue holds nearby veins in place so they can't bulge into the anal canal. A 2003 study compared infrared coagulation and rubber band ligation in terms of effectiveness and discomfort. The researchers found postoperative pain during the first week after treatment was more intense in the band ligation group. Pain and a feeling of constantly having to pass a stool was also more intense with the band ligation. Patients in the infrared coagulation group returned to work earlier, but they also had a higher recurrence and failure rate. The researchers concluded band ligation, although more effective in controlling the symptoms and obliterating the hemorrhoids, is associated with more pain and discomfort to the patient. Surgical intervention is now less frequently performed than in the past, but it can be considered for patients with acute complications of hemorrhoidal disease, or for those who are unable to treat their hemorrhoids with other measures. Surgery for the hemorrhoids, known as a hemorrhoidectomy, involves removing the hemorrhoid or the clot with a small incision. Having this procedure is generally an outpatient procedure, and it involves a 2 to 3 week recovery period. To get rid of hemorrhoids, it's important that you avoid constipation and hard stools. This can be done by eating of plenty of high-fibre foods to make stools soft. For how to get rid of hemorrhoids, the recommendation is 30 to 35 grams of fibre per day. Eat foods like avocados, berries, figs, Brussels sprouts, acorn squash, beans, lentils, nuts, flaxseed, chia and quinoa. In clinical studies, high-fibre diets reduce the risk of persisting symptoms and bleeding by approximately 50%. Some symptoms for the balance here would be zeolite clay or activated charcoal on an empty stomach, as these have a drying and bulking effect on the stool, and for the opposite loosening effect and speeding up motility, the herbal supplement haritaki, also known as the Indian walnut, is used. Dehydration can lead to constipation because water or fluid is required for fibre to travel smoothly to the digestive tract. Many studies, including one published in the European Journal of Clinical Nutrition, indicate that fluid loss and fluid restriction can increase constipation, which can worsen hemorrhoid symptoms. To relieve the constipation, and as a way to help get rid of the hemorrhoids, drink at least 1 glass of water with each meal and snack every day. Fermented foods like kefir, kimchi and raw pasteurized yogurt can help to provide the digestive system with the healthy bacteria that's essential for proper elimination. Several studies have shown fermented foods and probiotic supplements improve intestinal tract health. They synthesize and enhance the bioavailability of nutrients. They modify the gut pH and they aid in digestion. Alcohol can be dehydrating and hard on the digestive system, making hemorrhoid symptoms worse. Spicy foods can intensify the symptoms of hemorrhoids. Some studies show both alcohol and spicy food consumption serve as risk factors for hemorrhoids, although the data isn't consistent. To be safe, limit these foods until the hemorrhoids have cleared up. Straining during a bowel movement can be painful and make hemorrhoid problems even worse. Don't wait too long before going to the toilet, and pay attention to your body's signals, and when you feel the urge to use the bathroom, go right away. Otherwise, the stool will become harder, and this will automatically make you push harder. When you're on the toilet, take your time and relax your body. Constipation forces you to strain when using the bathroom, and this increases the pain and the inflammation on the hemorrhoid. To avoid constipation, drink plenty of fluids, engage in regular physical activity, and eat high-fibre foods that make the stool soft. These steps also help to answer how to get rid of hemorrhoids and prevent them in the first place. Spending too much time on the toilet can worsen the hemorrhoids. Don't read or distract yourself while using the bathroom. This only leads to more time spent straining. If stool is left behind after you wipe, it can aggravate the hemorrhoids even more. This is why it's important to cleanse yourself thoroughly after going to the bathroom. Do not, however, cleanse yourself too roughly, or use a soap that contains harsh chemicals, alcohol, or perfumes. Instead, use plain water to wipe yourself, and then dry your bottom afterwards. A sitz bath, which involves sitting in warm water for 10 minutes twice a day, can be helpful to patients with anal itching, aching, or burning, and it's known as one of the best ways to get rid of hemorrhoids fast. Butcher's broom can help reduce swelling and inflammation of the hemorrhoids. A 2002 study conducted in Germany found butcher's broom was an effective means of treatment for patients who are suffering from chronic venous insufficiency, a condition where the flow of blood through the veins is inadequate, causing the blood to pool. A 2010 study published in Phytotherapy Research investigated the efficacy of orally and topically applied Pycnogenol hemorrhoid cream, which is a pine bark extract, for the management of acute hemorrhoidal attacks in a controlled randomized study with 84 subjects. Within less than 48 hours of an attack, the patients were enrolled and their signs and symptoms were scored. The decrease in the score was significantly more pronounced in the Pycnogenol group than the control group who were given the placebo. This study indicates oral and topical Pycnogenol helps to heal acute hemorrhoids. Horse chestnut is commonly used as a herbal remedy for poor blood flow and swelling. According to research that's published in Alternative Medicine Review, the horse chestnut has been shown to improve microcirculation, capillary flow, and vascular tone, all of which are helpful for getting rid of hemorrhoids. Witch hazel is a plant that's used for its skin healing, astringent, and antioxidant properties. The topical application of witch hazel can help to soothe the hemorrhoids by reducing inflammation and pain. Psyllium husk is a natural source of pure fibre that's sold in powder form. Studies suggest that plant fibres like the psyllium husk can reduce the frequency of bleeding when using the bathroom, and they can help avoid constipation and straining. When using the psyllium husk, make sure you drink plenty of water. A 2011 study published in Digestive Diseases and Sciences found psyllium husk has a gut stimulatory and laxative effect on mice, but at higher doses it has an anti-secretory, which reduces the normal rate of secretion of a bodily fluid, and an anti-diarrheal activity. Cypress essential oil stops excess blood flow, and it promotes the clotting of the blood. This is due to the hemostatic and astringent properties. The cypress oil helps with the contraction of blood vessels, and it tightens the tissues. It's also known to reduce anxiety, and this can help to relieve constipation for some people. Use the cypress topically by adding 3 to 4 drops to a cotton ball and applying to the area of concern. Helichrysum essential oil helps to stimulate the secretion of gastric juices that are needed to break down food and prevent digestive issues. It also serves as an anti-inflammatory agent when applied topically. To use the Helichrysum, rub 2 to 3 drops into the abdomen or the area of inflammation. A common concern is that hemorrhoids increase the risk of colorectal cancer, but this isn't true. However, the two conditions do cause similar symptoms. This is why it's important to mention your hemorrhoids to your healthcare provider. Even when a hemorrhoid is healed completely, a colonoscopy can be done to rule out any other cause of rectal bleeding. According to the American Society of Colon and Rectal Surgeons, every person aged 50 or older should undergo a colonoscopy to screen for colorectal cancer. If non-medical treatments don't work, there's a relatively painless procedure that can be done to treat hemorrhoids. For extreme cases, an outpatient surgery is called a hemorrhoidectomy, and this could be required. Sitting in a warm bath can help reduce the swelling and the irritation caused by the hemorrhoids. Some research says it's best to sit in a warm bath for 20 minutes following every bowel movement. Adding Epsom salts to the bath water can help to increase the beneficial effects of the water and reduce the irritation of the hemorrhoids even further. Applying coconut oil to hemorrhoids can reduce the swelling and the irritation while reducing the urge to scratch them, as it's a natural moisturiser. Aloe vera is known for having healing and anti-inflammatory properties for skin irritations. If applied to hemorrhoids, it can help to reduce the swelling, itching and the burning associated with them. Be sure to use pure aloe, however, as the additional chemicals or compounds in diluted aloe vera could cause irritation or worsen the problem. Sitting on a cold compress or an ice pack when the hemorrhoids feel irritated can help reduce the swelling and numb the irritation. Wrap a cold ice pack in a towel and place it in the area where the hemorrhoid is underneath you. Keep it there for 15 minutes and repeat hourly to maintain the relief that it provides. The herb Goldenrod has been used as a natural remedy for centuries to treat hemorrhoids, and it's well known for its anti-inflammatory properties. Steep the goldenrod for 15 minutes and then strain out the water. Add this water to a sitz bath for relief. The herb yarrow also has anti-inflammatory properties and was traditionally used in European countries as a natural remedy for hemorrhoids. The yarrow can be placed directly into the sitz bath for relief from the hemorrhoid symptoms. Almond oil is used for external hemorrhoids. The almond oil has softening properties and it soaks into the deep tissues of the skin, easing inflammation, burning and itching. You can place a few drops on a cotton ball and apply it directly to the affected area. This can be done several times per day. Olive oil is used as a treatment for external hemorrhoids due to its anti-inflammatory and antioxidant capabilities. It helps to increase the elasticity in blood vessels, and this helps to reduce inflammation and swelling. The olive oil can also be consumed to treat hemorrhoids. It can also be combined with the juice of prune leaves and applied topically for external relief. Black tea bags contain tannic acid, and this acts as a natural astringent to shrink the tissue and reduce the swelling and pain caused by hemorrhoids. Wet a tea bag in hot water, remove the tea bag and wait until it's cooled to warm. Apply it for up to 10 minutes to the affected area. This can be done 2 to 3 times per day. Some claim that apple cider vinegar can help to dry out the hemorrhoids and reduce irritation that they cause. But doctors don't recommend this remedy, as it can actually burn the skin in the area if applied incorrectly. To book a consultation or to learn about herbs, supplements and natural treatments, check out my website.